Hello, everyone. I'm Dr. Sri Banerjee, student in the Criminal Justice Program, and I wanted to go over today about the corrections reform strategies comparative analysis. So, mass incarceration has been the tradition of correction. In from the 80s onward, there has been a push to kind of shift over from mass incarceration to ways that you can kind of decrease recidivism and reoffenders. The idea is that once you are in a life of crime, this kind of pervades all walks of life. The idea is that if you can control and address some of these issues that lead to poor outcomes, then you can have less recidivism and less reoffense. So the idea is to create reentry programs. So let me go ahead and break this down piece by piece. Before we go forward, let me tell you that we're going to be going over reentry program overview, just giving you a brief understanding, a little bit of a history, and then I'm going to be describing to you, in general, the reentry program, and more specifically, I'm going to be going into. There's so many reentry programs, but in the United States, I'm going to go into substance abuse treatment, and I'll explain to you the reason, but just briefly. Violence is connected with substance use, is connected with kind of dealing in substance use. So all of these create the fertile ground to be able um, to continue violence. So I'm going to go into some of that, and then we're going to end with the reentry program in Sweden and kind of compare the Swedish reentry program to the American one. So before we even get started evaluating reentry programs, I wanted to start with kind of the founder of prison reform and decreasing reoffending. So basically, clients who are assessed as being at higher risk for reoffending, and this is something inherently obvious, but I'm going to make a leap that is not necessarily obvious. Um, so those that are assessed as higher risk for reoffending are more likely to benefit from treatment than lower risk clients. So higher risk clients should receive more intensive services than lower risk clients. And this is a principle. This is a guiding principle known as the risk principle, and this is an idea Dr. Andrews came up with. So let's kind of translate this to another concept, and let's replace addictions with with treatment. So even though this is saying treatment, but we're translating that to addictions and violence reform. And this same thing, people that are at higher risk of substance use, then you want to treat them more aggressively, and kind of have less intensive peer support, that may not include pharmacological interventions to try to address and treat. Same thing about violence reform. All right, so um, the idea of correctional treatment is something, of course, Donald Andrews invented as well. The risk principle was the first thing, and now he's going more into correctional treatment. And this is a concept that you may not be familiar with, but um, the correctional treatment is managing their mental health, reducing the likelihood of reoffending after release. So notice the concepts that are guiding principles has been thus far in addressing substance use, addressing mental health, because all of these factors are interconnected, and to be able to address one is not quite adequate. You have to address multiple factors that are creating the conditions for incarceration. Um, Reentry programs are difficult because society has stigma against people that have been to prison. And this is, let's face it, this is a fact. I mean, if you have been convicted of a felony, then forget about getting a job because they run a background check. Many government jobs as well, they run background checks. And then they kind of discriminate against people that have previously gone to prison, even if they're minor sort of offenses. Maybe something happened when you were when the person was in their teens, and that no longer applies to that person as they have matured. So there's indeed a job stigma, but then even housing stigma, because there's actually policies that prevent people from participating and acquiring subsidized housing if they have been convicted of a felony. Um, let's take a look at stigma. I mean, stigma is a very broad topic. I mean, many things, including HIV, has had stigma. But the problem is that when you have um, multiple sources of stigma or discrimination, then they combine together and really create a difficult situation for the person. And so intersectionality, Crenshaw was the first individual to introduce that, but this completely applies in this situation. So let's take a look at the program overview. This is one of the reentry program overviews. Of course, thinking about stigma is especially important. I kind of went over that. And subsidized housing, employment, these are something, there's stigma attached there. When you have reentry programs, though, kind of understanding the broad connotations of reentry, this can help reduce recidivism and also as a result improve public safety and save money. So those of you, those people out there that are thinking that these reentry programs are really spending taxpayers' dollars that may or may not be effective, the reality is there's a lot of money that is saved long term that people can necessarily not identify. So let's look at one of the reentry programs. I'm going to visit a couple of them, and some of them are actually connected. So long-term offender programs, these are very intense programs. There's 34 sessions, and this is the highest number of sessions. Actually, the next one is, but quite an intense sort of program. But basically, the details are peer assistant is a support to the facilitator and a role model for the inmates of the program. So you want to have people that can kind of see at the level of people that are kind of going through that process and be able to help them in that process. So the peer assistant aids in the delivery of the program content, giving insight during discussions, model, and role play with the facilitator. So a lot of this is going through examples and allowing the offender to be able to kind of drive their own treatment. Now, something that is more prescriptive is the high intensity violence prevention program. And this is really developed for people that have at least 10 years that they're going to stay in prison, all the way to lifers. So this is kind of a broad range, and there's 4 modules, and also cognitive behavioral skills, social learning, and problem solving. So these are, again, intense programs that allow for potential rehabilitation and decrease in recidivism. So let's go into substance abuse treatment. This is has been kind of the focus of the reentry programs that I'm looking at in the United States. Currently the prison system is overcrowded. 1.6 million inmates around the country. And the idea is these individuals kind of get stuck in the system and are not allowed to, or are not able to reform. So 1.6 million people, and majority majority out of these people have drug problems and addiction treatment. Um, and addressing these problems can lead to improved public health. Um, there's also high relapse rates among parolees who never received addiction treatment in prison. So compared to people that haven't received addiction treatment, people that do receive treatment um, have low relapse rates. Um, so there's success, but the caveat is that let me rewind here. So the content that's there in some of these substance abuse treatment programs is to address criminal lifestyles, provide skill building opportunities, and this goes on for 12 weeks. And also there's cognitive behavior therapy. And that's kind of like understanding the way you think and changing that in a way. So by managing the mental health and the physical health problems, you can kind of get to the core and be able to change the way people think and behave. So, substance abuse treatment, the tragedy is that even after treatment, um, more than half of graduates of many prison treatment programs are not completely successful. Um, so there's, in some cases, relapse within 12 months, necessitating the establishment of community drug treatment. So what this means is that, yes, there are places that there's low success rate from these substance abuse treatment programs. But if you continue kind of this process of treatment, substance abuse treatment through cognitive therapy, and some other techniques into the community, if you can continue that onto the community, then you're able to kind of be more effective in treating treating substance use. I wanted to bring in over here. I wanted to bring in Goldstein's framework here, and this was actually developed in the 80s, but this theory actually stuck with me through the years. And basically, the idea is that there's a tripartite model. So this is kind of the drugs violence nexus, they call that. And this is kind of the combination of all of these facets to understand and create a theory that combines all of them. Um, Three things, obviously tripartite, that causes violence, according to Goldstein, was psychopharmacological. Now, this is obvious. People might be influenced, under the influence of drugs, alcohol, some of the mind-altering substances, stimulants, depressants. These actually cause, like amphetamines, these might cause excessive aggression among people. Economic compulsive. Now, this is also kind of obvious because people that are impoverished, they're going to find other means to forget about the situation, the poverty that they're living in, and kind of embrace something that is easy to access, such as drugs. And then systemic. So if there's a network or a kind of an environment that promotes dealing of drugs, drug distribution, then people are more likely in the neighborhood to join these sort of approaches because of lack of role models that are not doing that. So this allows people to address some of these, even social scientists and some people in the field, public health practitioners, to be able to address this. So let's fly overseas and go to Sweden and see what is going on there. First of all, I wanted to kind of start with the fact that recidivism and reoffending is actually very low in Sweden, and some of the Scandinavian countries, they're very successful in prison reform, and I think we really should look to them as examples. So, according to Becker Pesca 2022, e-learning in prison can result in positive outcomes. This is actually very effective because there's not necessarily as much security needed, since these are virtual interactions, and in the same time, the prisoner is acquiring skills to be able to be successful. Young offenders are actually helped through subsidized work programs. So remember, I was telling you some of the work programs are limited to people that are not prisoners in the United States. Well, they're not necessarily worried about that because they have work programs that are there. And by the way, this is mainly that I'm talking about. The reentry program is the work program, and this is very effective um, because this actually limits reoffending. And if you compare Sweden to many countries, then you'll see that the recidivism rate is really small. And there's shorter prison sentences that would free up significant sums of money to spend on job training. Um, so the prison sentences are more are not as punitive, and allows for inmates to be able to engage in activities that can make transition into community living more effective. So something that I wanted to go over is something called the CRAMI program, and this is a specific type of reentry program that is similar to some of the other facets that I've gone over. So the CRAMI program is run by Sweden's National Employment Services, Prison and Probation Services, and municipal authorities. This is overseen by a local steering group composed of representatives from the three partners. Participants are directed to the government insurance via social workers, probation officers, employment centers, and team-based approach shows for a more successful prison system and has low recidivism rates. So, in summary, what is this trying to say? This is a group and a team approach that is allowing for the prisoner to be able to re-enter the workforce and at the same time be able to interact with social workers, employment centers, so that they can get a job potentially um, after they are released, after inmates are released from prison. Um, so a lot of these programs, there's actually rules, and this might be very difficult for people that have issues with substance use and addiction. Um, so this is very important to focus, but very difficult to maintain. But again, there's a contract that you have to follow, and there's good to have ground rules when you're trying to rehabilitate inmates. So there's again dedicated social workers giving the ex-offenders 3 weeks of training focused on instilling a positive mentality and work ethic. A positive outlook can lead to improved successful outcomes, and then reoffending rates. Just to give you some perspective, I'm an epidemiologist, so I take a look at numbers and percentages. The recidivism rate is 40%, and actually, the United Kingdom and United States is double recidivism rate than Sweden. So they must be doing something right, and we probably can learn a lot from some of the programs that they have in place and successful programs that have been proven time and time again. So that concludes the presentation. I wanted to leave with some pointers that you might use to create recommendations and potential policy change, and that eventually that's the objective of what we're trying to do. So conclusions, we started off talking about prison stigma. Remember, we're saying that job-related stigma, housing-related stigma kind of hinders people from integrating into normal society. So we need to address those. I mean, there's no reason that subsidized housing should be denied to anyone, including people that have previous felonies. Now, there might be some ways to kind of differentiate, but there's no reason to discriminate against a whole group or against a whole population. So when you have these reentry programs, not only are they helping the prisoners and the people that are inmates, but this is also helping society, saving money, allowing some of those stigma to be addressed. These reentry programs are vital and very important to implement if we want to have a more improved society. Um, there's in the United States, there's substance abuse treatment programs. These are very effective because substance use is closely intertwined, and a majority of the inmates have substance use problems simultaneously. Um, so comparing Sweden to the United States, Sweden has a lower half recidivism rate as United Kingdom, United States. I think the United States can include more effective programs. They can actually address some of the psychological and the mental health ramifications, thereby improving, thereby decreasing recidivism. And Sweden just has been more successful. So let's take some of these ideas from different countries and transplant them into the United States and be able to have a more successful reentry into society. Thank you for listening. Here are some of my selected references. Thank you.